Hello and welcome back to the Nursing Hustle. My name is Natalie and we are going to get right into this. I found this job through this company. It's called Actilent, right? And many people have asked me, hey, Natalie, what do you do? So basically, this is my job. I am a patient safety nurse. I started off as a consultant, just like this job. This is a consulting job, right? It pays $45 to $50 an hour. Here's what you need. You need 5 years experience as a registered nurse with acute care, ER, critical care, or blood banking, donor or transplant. You need an active RN license or BSN. Prior FDA device pharma experience is nice to have. I love it when they say this because that means it's not necessary. If they can't find somebody with this experience, they will take you and train you. I had just reached out to a recruiter I use because I'm trying to gather some recruiters to work with so that when jobs come up, I can bring them to you. Okay, so here's the deal with this. The pay range is $45 to $50. Sometimes you could negotiate. They do offer medical, dental, and vision. This is a fully on-site position. This looks like a full-time job. This is a job patient safety specialist, RN case manager, case review. This role is on-site Monday to Friday. We would have to call them to find out if this is full-time or contract. I was so excited to bring this to you because this is exactly what I do. Some of these companies will bring you on to contract with them for 6 months. Sometimes it's a year. It depends on what they need. If you find a recruiting firm that is working as the intermediary for them, they sometimes do offer insurance, medical, dental, and vision. When you're consulting, sometimes they offer a per diem, which gives you a little bit more money on top of your wage. When you're not hired on as a full-time employee, sometimes you get a per diem for being away from home, and they will allow you to fly back home every 2 weeks, and they pay for that. They pay for your flight back home, they pay for your hotel stay. But it looks like this role is on site, working the hours of 7:30 to 4. So it's not clear from this posting whether or not it's full time. This looks like it could be full time or it could just be consulting. And if it's consulting, you would have to discuss that with the recruiter. But this is one of those jobs because there's so many nurses out there that are looking for work and willing to travel and be away from home. I worked with a lot of nurses who were away from home for 2 weeks. They would fly home for the weekend and then come back and stay for 2 weeks in the area where they were working. This seemed to work out for the companies, especially if there are remediation projects going on, which means that they have files that they need nurses to go through. The deadline for this position is January 28, 2025. They serve many Fortune 500 companies. I work for a Fortune 100 company here in the US. I've consulted for Fortune 100s, Fortune 500s before, and they do have PTO, vacation, and sick leave, right? Transportation benefits, employee assistant program. When you're consulting, it's a little negotiable, but you would have to call Actilent to find out whether or not this is full time or if this is consulting and what the terms are. My nurses out there that are looking to hustle smarter and not harder, you're tired of doing those travel positions into the hospitals. It may not be as much as what you get if you travel into the hospital, but there are some benefits for traveling anywhere you go. There is a per diem that they have to pay you for your food. I think it's for food and I forget what else. But that's something that can be discussed with the recruiter. This job is in New Jersey on site. Okay. So, and you can go to at the Actilent website. I will post this link in the description box for you so you can go ahead and apply if you want and give them a call. So, this is a consulting position. Actilent is a consulting firm. They won't tell you the name of the company until you talk to them and apply. They don't like to divulge that information. These companies compete with one another for placing consultants into these positions. So they often do not give out that information until you have applied. And if you're working with one company, for instance, and you apply with them, you cannot leave them and go work for another company for that same position. But when this contract is over, you can go anywhere you want. This is what I love about this type of consulting. So many people have asked me about these positions, and I was like, yes, I found one for you. There's another position available through another company. They are looking for someone. I asked the recruiter to send me I asked him to send me the job description so that I can share with you also. If you click the link in the description box, I just wanted to come in real quick and share this with you. Let me know what you think. Drop me a comment down below. Let me know what you're looking for. And if anyone applies for this and gets this job, reach out. Just let me know. I just want to know that people are getting hired from these jobs that I'm sharing with you. And if you need help with your resume, you can send me an email. I'm going to be working on something to help people like cater their resumes, especially if you've never worked at a place like this before. You can tailor your resume to this type of job. My next video or two, I'm going to show you a mock template of a resume that of someone, just generic. It won't be anyone in particular. It'll just be a generic person applying for a position and what their resume would look like and the types of things they would say to get themselves attracted. What did they ask for? FDA device pharma experience, because they say it's nice to have. So there's some other experiences that might kind of relate to this that you can add that will give you an edge. I hope this found you. Let me know what you think, and I will see you in the next video.